Hi guys, welcome back to my YouTube channel. This is Nursing with Sylvia, and in today's episode, I'm going to be teaching you guys the basic instruments you ought to know as a nursing student, and I'll be giving the uses and also the method of cleaning these instruments. Questions comes out in like in your OSCE, your Bible. You can see questions like what is the function of this instrument, what are the method of cleaning this particular instrument. So sit back and watch and make sure you learn from this video. Welcome back, guys. So the first instrument we'll be looking at is the sphygmomanometer. What's the sphygmomanometer? We said it is a BP apparatus. It's an equipment used for checking the blood pressure of an individual for either early diagnosis, for treatment, and to identify possible abnormalities in the blood pressure of an individual. And we also said that the normal range for this blood pressure is between 80 to 120. In an OSCE setting or in a viral setting, you're meant to talk about the normal range of the blood pressure if you are asked to identify what the maybe the blood pressure apparatus is, as the sphygmomanometer is. Then the method of cleaning, you can wipe the cuff with disinfectant, and then for the manometer, you can just use a clean cloth to wipe that area. No need sending it to the autoclave for sterilization. So the next instrument we'll be looking at is the thermometer. Now, this particular thermometer is called the mercury in glass thermometer. And what is the function or the use of this thermometer? Is used to monitor or to check the body temperature of an individual. Now, how is this thermometer being taken care of after use? After use, you use a cotton swab to wipe the thermometer from the tip to the bottom, meaning from the parts where you are to insert the thermometer into the axilla, that's the armpits of the individual, down, because you we don't want to infect that area. So we are wiping from up to down. Pulse oximeter. Now, this instrument is an instrument used in checking the oxygen saturation of an individual or a patient. How do we take care of this? In some hospitals, we actually call this SpO2 machine. It's also used in checking your pulse too. It doesn't just give only the oxygen saturation; it gives both results for the pulse of an individual. Now, how do you take care of this? You use a swab to clean the probe of the oximeter. Now, please do not insert this oximeter in any form of liquid. Do not insert. You don't send it to the CSSD for sterilization. You just clean with a swab that is damp and does not have dripping liquid from it, and you clean and you keep it to dry. Now we go to the tongue depressor. Now this instrument is used in depressing the tongue during procedures like oral care or oral hygiene, when you're trying to clean the mouth of a patient. You also use it in throat examination. You're trying to examine the throat. Then also use it in throat swab, in a procedure known as throat swabbing. You're trying to collect swab from the throat. You also use it for procedures like oral examination. You're trying to look out for things in the mouth, examine the mouth of a patient. We use this tongue depressor to depress the tongue. Now it comes in two forms, either the wooden or the metal. Now the method of cleaning for the wooden is usually disposal. The moment you use it, you have to dispose it. You can't clean it or reuse it. The next one is the metal tongue depressor. After use, you wash it and you send it to the CSSD for sterilization or autoclaving. Dressing forceps. Now, a lot of students make the mistake of calling the dressing forceps an artery forceps. They are not the same thing. Okay, this is how you differentiate a dressing forceps from an artery forceps. If you look at the picture, the diagram in on your screen, you will observe that this particular forceps doesn't have a clamp. It does not have a clamp. The artery forceps has a clamp. So this is how you identify your dressing forceps from your artery forceps. Now, the dressing forceps is used for dressing wounds. It's used in procedures like wound dressing. Sometimes we use it to, hold your gauze or your swab in place while carrying out wound dressing procedure. Then the method of cleaning this particular instrument, after use, you rinse, you wash, and you send. So you wash, you rinse, and you send to the CSSD for sterilization or autoclaving. The gallipot. Now the gallipot is a small round bowl that is used in holding in lotions, antiseptics, and little materials in wound dressing. It's most especially used in holding or keeping cotton swabs. This is to prevent the antiseptic solution from evaporating. It usually comes with a lid or a cover. You cover it. For example, you put in your cotton and you pour in your spirit or any type of antiseptic solution. Now, to prevent this liquid or antiseptic from evaporating, you cover it, and you can use it during any type of procedure like wound dressing or any procedure that requires a swab. Now, the method of cleaning is washing and sending to the CSSD for sterilization. The next is the toted and non-toted dissecting forceps. Now, this dissecting forceps is used in, like, when carrying out the procedure, is used in helping to hold tissues for the surgeon to be able to dissect properly. You can also use this dissecting forceps in wound dressing. Is used to squeeze cotton swab to squeeze excess liquid from the swab. The method of sterilization is you rinse, you wash, and then you send to the CSSD for sterilization or autoclaving. The male urinal or the urinal, it is a jug-shaped container and is used in collecting urine from bedridden male patients. And how do we take care of this urinal? How do we clean it? You wash it, you disinfect, you rinse, and you dry. The bowl lifter. Now, this instrument has an handle and a prong-like end. It is used in lifting hot bowls from the sterilizer or the autoclave, and it is cleaned by washing, rinsing, and sterilizing or sending to the CSSD for autoclaving. We go to the trolley. The trolley has 2 to 3 shelves with a wheel which aids in pushing and easy movement of the trolley, and is used in placing wound dressing equipment, drugs, and materials that you enable you take it to the bedside of the patient or to the storage room or to anywhere. Now, the method of cleaning this trolley is by using disinfectants to clean after use or carbonization. The sputum mug. Now, this is a mug with a lid that's like a cover. It is used in collection of sputum. You can collect the sputum either for examination or you collect the sputum for disposal. Now, the method of cleaning is you wash, you disinfect, you rinse, and you dry. The kidney dish is a kidney-shaped shallow dish and is used in holding dressings, vomitors, equipment. Sometimes you're carrying out a procedure, you use an equipment, you can place the equipment in the kidney dish. It's also known as the receiving dish. Now, the method of cleaning this particular instrument is by rinsing, washing, sent to the CSSD for sterilization or autoclaving. The Cheeto forceps is an instrument that is used for handling sterile equipment. Like, for example, you want to remove a gauze from a sterile drum, you use the Cheeto forceps to remove the gauze, or it's also using opening sterile packs. Now, these Cheeto forceps also have their containers which they are being kept in to prevent contamination. And the method of sterilization is you wash, you rinse, and then you send to the CSSD for proper sterilization and autoclaving. The towel clip is an instrument. It has ring handles and sharp curved clips. It's used in holding towels, like is used in forming drips during surgical procedures. For example, like we're carrying out a surgical procedure like appendectomy. Now, the surgeon uses this towel clip to form a drip by clipping the towels together to form a drip and allowing the sites that will be needed for the procedure to only the sites that will be needed for the procedure to be exposed. And this method of cleaning this towel clip is by washing, rinsing, drying, and sending to the CSSD for sterilization, or you can just say autoclaving. The ophthalmoscope is an instrument that has an handle, a light source, a viewing aperture, and also a lens system. It is an instrument used in examining or in the examination of the interior eye. You can use it in eye examination. That's just basically what it's used for. And then method of cleaning, you can clean the lens with a cotton, or you can clean the lens with a cotton and then use disinfect the handle. Yeah, please do not dip in water. You can just disinfect the handle. The otoscope has a handle, it has a magnifying lens, a light source, and a speculum. Now, it is used in examination of the ear. It is used to examine the ear canal and the tympanic membrane. How is this instrument cleaned? If the speculum used is disposable, please kindly dispose after use. If not, disinfect and store in a clean, dry place. Doyle's retractor. Now, this retractor is used in surgical procedures. It helps in retracting soft tissues and organs so that the surgeon, during surgical procedures, mostly in abdominal surgery, so that the surgeon can be able to have a clearer view of the surgical site or the place he wants to carry out the surgical procedure. Now, how do we take care of this particular instrument? After you use, you wash, you rinse, you dry, and you send it to the CSSD for autoclaving or sterilization. The tuning fork is a stem with 2 prongs and is used in carrying out hearing tests, either the Weber's test or the Rain's test. Most times is done by stimulating this tuning fork and placing it at the mastered process of the patient. Then the method of cleaning the tuning fork, you disinfect with either disinfectant or a spirit swab. most times they don't usually send it to the CSSD for autoclaving. Now we have the patella hammer. It has a handle or a rubber head. That rubber head can be either be round or triangular. It is used to elicit the tendon reflex. Most times you see doctors, they come in, they use the hammer to like hit the patella of the patient, and they want to see the response, if the patient is able to respond to pain or be able to feel it. Method of cleaning is by disinfecting with either a disinfectant or spirit swab. The bedpan is an instrument used in collection of urine and stool in bedridden patients, and after use, you wash, you dry, you disinfect, and you just store in a dry place and in a clean place. The curved or straight artery forceps. Now we have what we call the mosquito forceps. Those are like the smaller size of the artery forceps. The artery forceps are used in clamping blood vessels to control bleeding. It is used mostly during surgical procedures. Now, how do we clean this artery forceps? After use, we wash under running water, we rinse, and we send to the CSSD for autoclaving or sterilization. The scalpel handle is an instrument which has a handle and a slot for inserting the scalpel blade, which is used for surgical incision. Now, how do we take care of this scalpel handle? After use, you wash, you dry, and you autoclave. You send to CSSD for sterilization. Now we have the scalpel blade. From the diagram, you would have seen how it looks like when you attach the blade to the scalpel handle. Now, we already know that this is used for making incision. And after use, you dispose the blade and send the scalpel handle to the CSSD for sterilization and autoclaving. The tray is a flat metallic surface and it's used to carry sterile instruments, materials, and medications around. You can place them in the tray and put it on the trolley for easy movement. And how do we take care of this tray? After use, you wash, you dry, and send to the CSSD for sterilization. The sterile drum is a cylindrical drum. It has lids with perforations and it's used in storing sterile instruments and materials. For example, most times in the hospital settings, it's used in storing gauze, sterile gauze, and swabs. Now, after use, you wash, you rinse, you send to the CSSD for autoclaving or sterilization. The airway or the oropharyngeal airway. Now, this instrument is used to ensure patent airway in an unconscious patient. For example, there is a surgical procedure that is to be done. Now, the nurse anesthetist usually puts this airway to ensure that there is no obstruction while the patient is unconscious during the surgical procedure. There is no airway obstruction. Now, how do we take care of this? Depending on the type of material we are talking about, you either disinfect or you sterilize this or autoclave this material. Sometimes it's even best to dispose after use. The screen. Now, the screen is used in providing privacy for patients while carrying out various procedures. Now, you take care of the screen by, if the clothes are removable, you remove and wash. If not, you disinfect. You use a cloth to, disinfect the materials. The mouth gag is an instrument used in keeping the mouth open during oral examination, surgical procedures, or even oral care in an unconscious patient. Now, how do we take care of this mouth gag? After use, you wash, you dry, and you send to the CSSD for sterilization or autoclave. The cardiac table has a flat tabletop and an adjustable height. It is used in placing patients in cardiac positions. Now, after use, you disinfect and keep in a dry place. Mortar and pestle. This is used in grinding and mixing medications. Now, in situations where we have an unconscious patient or a patient who is unable to swallow, we grind these medications and make it in a liquid form and administer these medications through NG tube, that's a nasogastric tube. Then, after use, you wash and rinse the mortar and pestle thoroughly and dry. The needle holder is an equipment used in holding suturing needles in place during stitching. Now, it is used in surgical procedures and also in wound dressing. That is, it's used to hold needles, suturing needles to stitch or to suture wounds or lacerations. Now, the method of cleaning or taking care of this needle holder is by washing, drying, and sending to the CSSD for sterilization. The sponge holding forceps. Now, this is an instrument from the word sponge holding forceps. We already know that it is used for holding sponge, meaning that we use it in holding materials like gauze, swabs, and used in cleaning wounds or surgical sites. For example, a surgeon wants to carry out a surgical procedure. The surgeon uses the sponge holding forceps to hold the gauze in place and use it to clean the surgical site to prevent contamination. Now we care for this sponge holding faucet by washing, rinsing, drying, and sending to the CSSD for sterilization. The sandbag is a plastic or material filled with sand. It is used in immobilization of the limbs and also helps in positioning. Now, for example, a patient undergoes amputation. The sandbag can be used to place the limbs, can keep the limbs in place. Now, we can take care of this sandbag by disinfecting the material or the plastic and keeping in a cool, dry place. Straight and curved Mayo scissors. Now, these scissors have different uses or different purposes. You can use it to cut sutures, you can use it to cut deep tissues, you can use it to cut materials like gauze and so on. Obviously, it's a scissors, so it can be used to do several things. Now, you take care of the scissors by washing, cleaning, and sending to the CSSD for sterilization. The Foley's catheter. Now, this catheter has a tube, a balloon, a lumen. Now, it is used in continuous drainage of urine from the bladder. Sometimes during your vival, you might be asked what are the indications for the insertion of this Foley catheter. It can be used in an unconscious patient, and it can also be used in patients that has urinary retention or patients who wants to undergo surgical procedures. Then most times when this catheter is in situ, meaning when it's in the bladder, it's usually left for 2 weeks before being changed. And once it's being removed, it cannot be reused. It is advisable to dispose after use. So we've come to the end of today's video, and here is a little advice for you. So for all the instruments that has been mentioned today, ensure you know how to handle these instruments, because sometimes your supervisors might want you to use these instruments, like show them how to use these instruments. For example, the artery forceps, should learn how to open it up with the clamp, because they might give it to you closed and want you to open it and show them how to open and close it. So that's a little tip, and just know the parts of this instrument. I said some parts of the instruments in the video. If you were listening, you would have heard some. So I wish you the best in your exams, your Viva, and your OSCE, and see you in my next video. Bye.